Everybody, good morning. It is Thursday. Nope, it is Wednesday, the 29th of April, and we're here for our morning coffee. I've got mine. I hope you got yours. We're going to open up the entire time to my good friend, my mentor, and my veterinarian, actually, my dog's veterinarian, to Dr. Yael Sedone, who's the founder of Pet Vets Animal Hospital in Oak Park. She's been in business for about 25 years, right?
Yep.
Not quite. We're almost 24.
Yeah, so 23.
23, okay. And it's just, as I've mentioned before, probably and embarrass her for a minute, but the best veterinarian I've ever met in my life, and I've met a lot, not that other ones aren't great. And she is someone I go to for a multitude of things, everything ranging from my animal's health to my own health, and everything else. So she's great, and she's really taking some time away from her very busy practice to spend time with us. So I'm going to give her the floor. We are going to cover multiple things, including the stuff about pets, best practices, and then also how to talk to your clients and how to sort of engage around this. But I'm going to not say much unless you need me to. I'm here to help. I'll look at the comments and let you know if there's a question in particular, Yael. But other than that, the floor is yours.
Oh my gosh, I don't even know where to start. I think that, so first of all, I came into this very enclosed room. I'm here basically away from the rest of the staff, because when I'm integrated in the clinic and around other staff, and also around any clients who come in, I end up wearing this handy dandy thing. Okay. And this is a constant attire that happens like 10 hours a day. You wear this unless you're in your own little private space. So we're going to get to that in just a little bit here. But I think first and foremost, there's a lot of questions that's circulating around as to what is happening with the pet population in terms of transmissibility of the virus to pets. So specifically cats and dogs. And there's a lot of good information. There's a lot of misinformation. There's a lot of angst. But I think that the way to think about this is that cats and dogs are not definitive hosts for this virus. They do have receptors that can accept the virus, and so there is a very low chance that you can infect your pets. So, but we're going to separate cats and dogs a little bit because they are very, very different species. Thus far in the history of this virus, okay, there have been less than a handful of confirmed cases of cats developing actual COVID infections, and they present as respiratory and enteric, so that's gut issues. So cats are notoriously sensitive to coronavirus anyway, and if you are a cat owner, then you know coronaviruses and cats just don't mix. And it's why we have had issues with FIP now since the late 70s, and still here we are, still having issues with FIP. And so cats are really not great models when it comes to exposure to coronaviruses. And this one is no different. They have the potential of acquiring disease. How great is that potential? Well, there's been well over 3 million people across the world, probably a ton more than that, because those are like the symptomatic ones that were tested that have become infected with COVID-19. There's less than a handful of cats that have developed clinical disease of mild respiratory and some enteric issues, and plus the tigers that existed that are in New York. The tigers are the large cats are actually a lot more sensitive to coronaviruses than the domestic short hair cat or domestic cats. And so unless you're planning on bringing a tiger in a house, then you have a regular domestic cat at home. Dogs are considered to be very much not vulnerable to the virus. So cats are low vulnerability. Dogs are even lower than that. There's been 3 known cases of COVID being kind of taken off of dogs. One was the original, the Hong Kong, little Pomeranian creature that they could swab out its face and they got viral particles. There's no viral replication in that dog. He didn't have COVID. What happened was he was basically like a surface. So he must have been licking the owner's face who had COVID, and then he got it all up in his nasal passages where the virus kind of just hung out there like it would on a countertop for a bit. The next dog was like a German Shepherd, and that's quasi. It's questionable. Was there a little bit of viral replication? The dog wasn't sick. Nobody will ever know. But they were able to find viral remnants in that dog's face as well. And the third one, the more recent, and that's a pug. And so that particular dog on the East Coast was in a family that people had COVID, and he did develop some mild respiratory signs as well. And so he did have some viral replication. So what does this mean? It means that it is really, really, really unlikely that your pet or the pets that you care for are going to actually develop clinical disease and are going to undergo viral replication. But it also means that they can act like surfaces, and they can act like porous surfaces. So instead of a non-porous like stainless steel that can keep this virus on it for days on end, a porous surface, and especially fur, does not. It's usually dissipated pretty quickly. The bigger issue is what happens around their face, because as the owner is sitting there and they're sneezing and coughing and, oh, I'm just so sad and I'm just so miserable, and they're cuddling next to their pet, and now their pet is licking their faces and all that smuck. So now it's all over their, pet's face. And that virus can live in those nasal passages for longer than it's going to live on fur. So, here we treat all these patients as potentially being dirty surfaces, really. And so my advice to my staff and my advice to all of you who actually handle, so whether you're training or you're grooming or you're pet sitting or whatever it may be, is treat them like they're dirty money. Okay, here's a dollar bill. Okay, I'm not going to kiss you. I'm not going to have you kiss me. And if I've handled you, I'm going to wash my hands. And if you do that, you're going to protect everyone involved. If you just remember that, I know we love working with animals, and we used to cuddle them all the time, and now we can't. So not only are we wearing our protective masks, but we're not allowing for them to lick our faces, and we're not kissing them, and we're washing our hands.
Yeah.
So,
yeah, real quick question for you. We have a couple questions about should people, when they're walking dogs, so in a actual pet care situation, should they not allow other people to pet those dogs that they're walking? And what kind of distance should they be keeping as they're walking through a park or what have you?
So that's a really good question, because I think that ultimately any surface that you touch, okay, as a human being, we're the problem, okay, not them, okay? They are surfaces, okay? They're my phone, okay? My glasses, the dollar bill. Actually, my phone is actually worse because stuff will live on this for a long time. So the problem is that the random person outside, it's a little kid, it's a little old lady, they may not remember to wash their hands. And you can't guarantee that pet that isn't yours, okay, is not, not carrying something on their fur, right? And so unless you're in a position to say, wash your hands, or here's some hand sanitizer because you just pet this animal, I would say don't. For right now, until we get, the big issue right now, like why are we in a shelter in, okay, is because we failed. We completely failed at the idea of mitigation. And those of you don't get involved with infectious disease so much, it's a bit of a foreign term, because mitigation doesn't mean that you have zero cases out there. What it means is case management. And so we failed at management because we've been failing to be able to detect where the virus is, where's the hot spots, because that's where it's going to be transmitted among those individuals. Okay, the virus cannot stay in the environment for very long for someone else to come along and, I don't know, lick the tree, okay, or a park bench or whatever it is, and collect the virus. And so this portion of it, if you have strangers coming up the dog, don't have them pet it, okay, because you know, you don't want to run the risk of like now they may be doing one of these things all over their faces, or maybe they don't listen to you and they squat down and let the dog lick their face. And maybe there's potential that now you've exposed that individual. So I think that for ethical reasons, and of course, like for us to have like be socially responsible at this time, I would say no, just no until we have better mitigation.
Can you talk a little bit? I know we only have a short amount of time, and maybe we can talk about getting some materials to share later. But what about so veterinarians, obviously essential services. What are the things that are widely held as best practices right now for veterinarians as it relates to protecting their staff? So, because everyone here, most of our folks have. There's some sole proprietors, but most have sizable staffs, even up to 300, 400, 500 people on their teams. Yeah. So what do you recommend, or what are the top recommendations from a veterinary perspective, whether it's from AHA or from other sources? What's the best top 2 or 3 tips?
Okay, well, initially, and actually it's changing now, but initially AHA and AVMA put out this thing of don't let any clients into the building. Okay, everyone wear masks. You are wearing protective gear all over. You're washing your hands constantly, and no other human being except for just the staff is in the building. The reality check is that you can't practice that way. You just can't. And especially because telemedicine has limitations, especially when you have very sick animals. If you need to show people x-rays or ultrasounds, how are you going to do that, right? So, you have to find kind of like reasonable measures. And what does that mean? Well, remember how the virus is transmitted, right? It's going to be through this. This is it, okay? It's your face. And so if within your staff, okay, you have everyone wear protective gear, okay? It's a surgical mask. If not, by the way, this, okay, has a surgical mask inside of it. And the cotton overlay, this is cotton. So you want natural fibers. So like cotton, don't use like polyester. That's really bad with this virus. So because you can wash this on a regular basis and you'll preserve your surgical mask. If you don't have surgical masks, just put a filter in it. Put a coffee filter. Put a vacuum cleaner filter. Put a filter in it.
So you can use, just so I understand, you can use a cotton mask of any kind, getting off an Etsy or what have you, and then you can put a filter. And so you should buy the mask that have a filter sleeve, and you can put a coffee filter in it.
Right. So the mask is open on both sides.
Okay.
All right.
Got it.
Inside, threaded inside of it is one of these things. Okay.
Okay.
And then, in order to preserve my ears, because I have to wear this for so many hours, okay, we've done all kinds of things. Like, for example, today, I'm going to turn around. I've got a pencil. Okay. Why? Because I hook it up to the pencil. And it holds very nicely. And it doesn't leave my ears raw. Because what ends up happening, what I notice is when people are sore, they start picking. They do one of these things. Yeah. And now you're touching your face. Right.
Okay, so that's a really awesome tip. A couple questions that are coming in specifically around veterinarians. Should people be rescheduling their annual vaccinations and annual exams? And beyond that, what are the things that you think need to be seen other than the obvious emergencies?
So the problem with seeing emergencies only is that you become reactive in your practice, right? So that 15-year-old cat, maybe right now it didn't have a stroke because of its hypertension, but a month from now, maybe.
Right.
And so the way that we worked around this is that all annuals and all tech appointments are telemedicine.
Okay.
We have a program, it's called doxy.com. It allows this type of correspondence. I actually got 2 extra iPhones, 11s. So because the old iPhones or the Android phones really suck at this kind of reception. And so people pull up, they call or they text to say, I'm here. We come out with our own leash. If it's a dog, if it's a cat, then you take their carrier. It's a handoff. Okay. Obviously, we're wearing our stuff. Okay. It's a handoff. We bring them in, do our thing. Okay. We contact the owner this way, so I get to see their faces. Okay.
So I'm sorry, I have to interrupt. So you take the pets in, but then you're having the exam on their phone?
I have, well,
Or you're having the correspondence?
Right, the rooms are set up with either a laptop like this, or it's a camera with a microphone. And so we can correspond basically the whole time.
I had no idea.
Okay, so they're not in the building, but they're also still a part of it, okay? And they could be a part of the whole thing, or they could be part of, like, basically I physical, and then we talk for a while and say, this is what I'm seeing. What kind of problems are you seeing at home? By the way, this is an annual. This is what we're due for. What do you want to do? Okay, so we still have, I find that with a phone conversation, a lot gets lost. Okay, I need to be like, you're nodding your head right now. Okay, and I can see your facial expressions, and right, and you can tell me when you're ready to say something too. So I can pause and listen, right? And so there's something lost when you can't see face to face. And so the telemedicine, as long as you have a good video and audio feed, they're sitting outside in their car. Okay, and yet we're still having a very personal conversation. I can see their face. I can ask them how they're doing. We talk about other things.
Do you think that technology and that practice, and this will be the last question because I know you've got patients to get to, and I want to respect your time, even though everyone's like just drinking this up. Do you think that same practice could work in a facility setting where someone would go out, take the dog, and then the call could be placed from the reception desk, the intake desk, to say, okay, so today, anything you want to let us know? Do you want to? So you think that this could be done, if it's not being done already, in the daycare environment?
Absolutely.
This is
a path forward for, like, all of you, groomers, daycare providers, the boarding facilities. There's no reason for owners to enter if you can actually see them.
Okay, this is huge. We're going to stop there because you've got patients. I love you. Sorry, everybody. I've got to say, I love you. And I.
It's okay. I wash my hands.
Everybody, thank you for all your good questions. I am obviously in close contact with Dr. Sedone, and if there's other questions that come in, I will happily, maybe not to her happiness, but text them to her. And then, perhaps we can talk about having you come back on in a couple weeks to talk about whatever is going on. As things move forward, we can figure scheduling out later. Everybody, thank you so much for joining us for coffee. Yael, I can't thank you enough. You know how I feel about you and how much I respect your time and how much this was great. Comments are awesome. I'll get more as we go along. Thank you very much. Everybody, I'll see you all later. She is the best. Everyone's saying that you're the best. Everyone's thanking you. Okay, all the things they're saying. Have a good day, everybody. See you later.